My name is Jonathan Bull. I'm a neurosurgeon and complex spine surgeon based in London with an NHS practice at the London Hospital in East London and a private practice between the Shard HCA and Cromwell Hospital. So typically the most common cause of neck pain is usually muscular in nature. That often comes from repetitive sort of straining of the neck muscles. That may well be associated with, particularly with office workers, where they will sit in a certain position to look at a computer screen. The computer screen may not be at the correct height or eye level. The keyboard may be not at the correct position, so end up straining or bending their head repeatedly, and that causes the muscles to become irritated and tired, and then eventually painful, and then may limit the degree of movement in the neck. Sometimes it's due to wear and tear change, which is a normal process. Again, that's usually self-limiting, but typically you'll have some degeneration in the joints on the discs in the neck, which is a normal process. And with that, it will cause some degree of pain and then stiffness, and it becomes a vicious cycle where the joints are irritated, the muscles become stiff, and the range of movement becomes limited. And less commonly, you may have possible compression, say, one of the nerve roots in the neck, which may give you pain down into your arm, into your hand, or into your shoulder, for example. Again, typically you manage that with conservative measures, but it will usually be, again, self-limiting. Common interventions with regard to avoiding developing neck pain, or if it's happened in the past and prevented recurring, would be looking at the ergonomic setup you have typically in your office or your working environment. Potentially considering things such as standing desks, trying to break up the period of time you spend sitting doing one activity or the other. So, for example, if you're sitting in front of a computer screen, trying to get up every half hour or hour and walk around the office, or maybe do some neck stretches, which may also improve productivity because it matches the period of people's concentration. Making sure that, for example, you're working your laptop, you're in a comfortable position, and the setup is not, for example, as most people do, sitting on the sofa, for example, or in a comfortable chair with their neck craned forward. But mostly simple interventions and probably a degree of common sense. So, having considered the ergonomic adaptations and trying to break up, say, periods of inactivity or sitting or standing, stretching exercises, which can be looked up online, are very helpful. Often, if you go to see a physiotherapist, they will advise you over certain exercises and stretches you can undertake independently. And doing those regularly, perhaps 2 or 3 times a day, will be most helpful. Most people will start off doing them several times a day, and then the frequency will diminish as the pain gets better. But then it gives them a sort of a toolbox of exercises they can use if the pain then recurs to prevent it becoming more severe. But simple stretching exercises, even activities such as yoga and Pilates, are very helpful as they improve core muscle strength and improve flexibility. Most neck pain is musculoskeletal in nature and is self-limiting and isn't a cause for major concern. It can be irritating and affect people's concentration. Sometimes the neck pain can radiate and cause headaches at the back of the head. Again, typically it won't be a sinister cause for it, and it should be alleviated by stretching exercises and simple analgesia. When the pain's associated with, for example, symptoms down into the arm or into the hand, then that may require at least a consideration of seeing a physiotherapist or your GP. It's usually, again, self-limiting. It very infrequently requires anything to be done about it, but it may well be that you have some irritation of one of the nerve roots, so a disc putting pressure onto the nerve roots, which may manifest itself with altered sensation, pins and needles, weakness, sometimes quite severe pain. And that situation may require you to be referred on to, say a spinal surgeon, where probably you most likely have an examination and then an MRI scan to determine if there's an obvious cause for it. But typically it's also managed conservatively with physio, exercise, stretching, and possibly stronger analgesia. Typically, most neck pain, as I mentioned, is self-limiting. You can manage it with physio interventions, so neck stretches, exercises such as yoga, Pilates, very helpful, simple analgesia, escalating up to some stronger medication for particularly nerve-related pain down into the arm and the hand. Less commonly, you may try an injection of local anesthetic and steroid under sedation using an X-ray guidance technique, which may be helpful for breakalgic, so arm pain, or even some type of neck pain. Very rarely, if there's evidence of persistence of compression of a nerve root or compression of the spinal cord, then you might end up needing an operation, but that's much the less common option. And that usually will be after a lengthy period of conservative management. If you had, for example, weakness in your arm that was persisting and getting worse, or pain that simply wasn't being treated with analgesia, so it's refractory to all the treatments you tried, then you might consider surgery, but that's the least common option.